Hi there.
Hello.
Today we'll be doing a head-to-toe assessment. Just be looking you over from head to toe. First, I would gather my equipment. I would do some hand hygiene. I would provide privacy for the patient. And then I would make sure that the patient's not in any acute stress, which he's not. I'd make sure there's no obvious deformities on the body. And then I'd also observe his gait while he walked in. And there were no involuntary movements. So I'd also observe his personal hygiene, and he's clean. He doesn't appear disheveled. His clothing looks appropriate for the season. Then I would look at his posture. He's able to sit upright. So now we're going to look over his head. He has appropriate eye contact with me. He's alert and awake. I'm going to ask you some questions to make sure you're oriented. Where are we at today?
St. Louis.
Okay. What are we doing here on this video?
We are doing an assessment.
Good. What time of the year is it?
Coming into winter.
Okay. Do you know what today's date is?
Today is December 16th, 2014.
Okay, good. So he is alert and oriented times 4. Next, I'm just kind of observing his scalp and his hair. His scalp has no obvious bumps or lesions. His hair is thick and full, and it's appropriate lined across the scalp. Now I'm going to just palpate and feel for any lumps or bumps. Any tenderness there?
No.
Good. So now I'm looking at his face, and it is symmetrical.
Bless you.
Excuse me. Okay. So I do hand hygiene again. Okay. So now I'm just going to feel his temporal arteries. And they are palpable, they're strong and equal. Now I'm going to feel on his temporal mandibular joint. Can you open your mouth up? Okay, can you close it? Any tenderness there? Good. I'm going to feel his frontal sinuses. Any tenderness there? Good. So now we're going to look at the eyes. We're going to do the confrontation test. So I'm going to put my hands behind there. You tell me when you can see them, okay?
No.
Okay, so the peripheral vision is intact. Now we're going to test for perla. I just want you to look ahead at me, okay? Good. Now I want you to look at my pen light, please. And now can you look at a distance? And now look back at my pen light. Good. So his pupils are perla. They're equal. They're reactive to light, and they're round. Now we're going to do the red reflex test. I'm just going to shine this light in your eye. Okay. Okay. And I'm looking for a reddish orangish coloration from the retinas, and he has that. Now I just want you to follow my finger, and it's going to go in 6 directions. I just want you to follow it each way for me with your eyes. Okay, good. Now I'm going to have you take this. I'm just going to have you cover your eye, one of them. Good, now pull it down for me. Good, now to the other eye. Okay, and then, so now I'm just looking for any ocular deviation, which he did not have any. So just inspecting the eyes, the eyeballs are symmetrical, the eyebrows are symmetrical, the eyelashes are all linear. If I pull down here, his conjunctiva is pink and his sclera is white. His corneas are transparent and there does not appear to be any abrasions on them. His irises are blue in color, and his pupils are about 3 millimeters in size. And then if I had the Snellen chart, I'd have him stand about 20 feet back and then cover each eye and have him read the lowest letters possible. Okay, now I'm going to look over the ears, just inspecting the skin first, the outer ear. No lesions, no drainage, and then the skin is warm and pink. And then I have my otoscope here. I'm going to take a listen or a look in your ear. Here, okay? Okay. Okay, so there's no blockages, no inflammation. I can see to the tympanic membrane, and it is translucent and pearly in color. Now I'm going to whisper something in each of our ears. You just repeat back what you hear, okay?
Have a great night.
Okay.
See you tomorrow.
Okay, so he passed both the whisper test on each ear. Now I'm going to go to his nose, and I'm going to just, can you breathe in? Okay, breathe in. Good. Now I'm going to look inside, okay? Alright. And no trouble breathing out of that. Good. And it is pink with no lesions inside the neck, or inside the nose. Next, I'll be looking at his mouth and throat, and his lips are pink. They appear to be a little bit dry. If you can open your mouth for me. So first, I'm going to look at the buccal mucosa. It is just pink and moist. And then I look at his teeth, and his gums look like they're in good condition. He has all of his teeth in place. Are those your natural teeth? No dentures or partials. Good. Okay. His gums do not appear to be inflamed at all. His tongue, can you stick it out for me? Good. So it is symmetrical, and there's no lesions on it, and it is pink and moist as well. Now I'm going to look just at, can you lift up your tongue for me? Oh, sorry. I'm going to look underneath your tongue. Okay. So the floor of the mouth is pink and moist with no abrasions. So now I'm just going to shine my light in there. You can just open your mouth. I'm going to look at your hard palate up there. It is pinkish white in color, and it is a firm texture. And then I'm going to have you open again for me, looking at the uvula this time. Can you say ah?
Ah.
Good. It raises when I have him say ah, so it has appropriate movement. Now this time I'm going to have you open it again and say ah, looking for the tonsils this time. They are in place. He has not had them surgically removed. They look about a grade 2. Okay, so I'm going to just simulate what the gag reflex would be. I would have him say ah. I'd stick the wooden stick on his tongue and simulate the gag reflex. That would state that his cranial nerves 9 and 10 are in place. Now we will move on to the neck. So just observing, it is symmetrical. There's no obvious pulsations, no jugular distension. I'm going to feel for your carotid pulse. Sorry, my hands are cold. Okay, now I'm going to look at the range of motion for your neck. So can you kind of just move it around side to side for me? Any tenderness there? Good. So now I'm going to have you push against my hand here with your neck. Can you just push? Okay, try this side. Good. So the muscles are strong in the neck. Now we will move down to the chest. And so just on inspection, his thoracic cage is symmetrical. It's elliptical shaped and has downward sloping ribs. And if I were to move him back here, I'm going to look at his scapula, his muscles back here, and his trapezius muscles. So can you take some deep breaths for me? I'm just going to feel here. So we have the symmetrical expansion. And when I palpate, there's no tactile fremitus. Any tenderness with me feeling here? Okay. And then there's no masses or lumps. So next I am going to auscultate his breath sounds. And I'm just going to take a deep breath on each one, okay? Good. So now I'm going to listen to his posterior breath sounds. Sorry. Okay, so now I'm going to perform a test called the agaphony, and if there was fluid present in your lungs, I'm going to have you say E and hold it while I'm listening to your lungs. If there was fluid present in my stethoscope, it would sound more like an A sound. So we're going to have you say E for me.
E.
Okay.
E.
Okay.
E.
Okay.
E.
Good. All right. Now I'm going to listen to your heart sounds. I'm going to start out here at the aortic valve. Then I move to the pulmonic valve, tricuspid valve, and the mitral valve. Now I do it with both sides of my stethoscope, so the bell side now. Then I would check his apical pulse, and his heartbeat is regular. And I count here for a minute. I'm just going to count to 15 seconds and multiply it by 4. And his heart rate is at 66. Now I'm going to evaluate his upper extremities. I'm just going to feel your pulses here. Okay, they are strong and equal bilaterally. Can you squeeze my hands for me as hard as you can? Good. Now I'm going to have you just move around your hands here. Good. Now while we're looking at your hands, I'm going to take a look at his fingers. And his nails are nicely trimmed, they're rounded, there's no clubbing that's being seen there. Okay, can you push up against my hands? Can you push down? Are you able to move your arms all around?
Mm-hmm.
Okay, so range of motion is good in the arms as well. Now I'm going to evaluate the range of motion of your shoulders. So can you move them up and down for me, around and back? Good, very good. Now I'm going to move on to the abdomen. First, I'm just going to inspect it, and I will go through it all. I'm not going to have him lift up his shirt, though. So his stomach is flat and symmetrical. I'm just going to take a peek here. So there's no bruising, no rashes or lesions. His umbilicus is inverted in its midline. No pulsation. Now I'm going to auscultate and listen for his vowel sounds. Start in the lower left quadrant. Move up to the left upper quadrant. Or the right upper quadrant, I'm sorry. Move to the left upper quadrant. And then the left lower quadrant. And his vowel sounds are normal active. So now I'm just going to palpate for any tenderness there? Okay. So now I'll palpate to feel the liver. And how to do that, we're going to do the scratch test. And I'm just going to percuss, so like a little patting down here until the sound changes to dullness, which I would mark right here. And then I would start to percuss down here. And then measure where the liver is. And the average is between 6 and 12 centimeters. I can do the same thing on the other side now, feeling for the spleen, but